Welcome to Capital Catch-up, your deep dive into the latest legislative action in Washington. I am Victor.
And I am Lainey. Today, we are unpacking a substantial wave of Veterans Affairs legislation introduced in the Senate, alongside major bipartisan House bills targeting artificial intelligence education and consumer protection.
Let us start with Senate Bill 201, also known as the ACES Act of 2025. This bill directs the Secretary of Veterans Affairs to commission the National Academies of Sciences, Engineering, and Medicine to conduct a comprehensive study on cancer among former active-duty military aircrew members.
Right, Victor. It specifically looks at cancer prevalence and mortality rates, identifying potential chemical and environmental exposures associated with fixed-wing flight service. By analyzing administrative data from both the Department of Veterans Affairs and the Department of Defense, the study aims to establish if there is a direct link between these flight exposures and specific cancer types.
This is a major step toward understanding the unique health risks our military aviators faced. And speaking of healthcare, there is a cluster of bills aiming to reform how veterans access and schedule their medical care. Senate Bill 275, the Access Act of 2025, seeks to codify and refine eligibility standards for the Veterans Community Care Program.
The Access Act would require the Department of Veterans Affairs to provide timely notifications about care eligibility and denials. It also mandates that the department consider individual veteran preferences, continuity of care, and caregiver needs. Crucially, it sets up an expedited screening process for mental health residential treatment programs, prioritizing veterans at high risk for suicide or overdose.
And if the department cannot meet its internal wait time standards for these mental health programs, the bill ensures veterans can access non-department facilities. To help with the actual scheduling of this community care, Senate Bill 654 requires the Department of Veterans Affairs to develop or purchase technology that allows staff to view and book real-time appointments with external healthcare providers.
This ties in directly with Senate Bill 607, the Improving Veteran Access to Care Act. This bill requires the Secretary of Veterans Affairs to modernize the department's entire appointment scheduling system by creating a user-friendly, self-service digital platform. Veterans would be able to view, book, reschedule, or cancel primary, mental, and specialty care appointments online, though telephonic assistance would still be available.
They have to submit the plan within 1 year and fully implement it within 2 years, integrating it with the Electronic Health Record Modernization Program. Meanwhile, Senate Bill 702, the Veterans Mental Health and Addiction Therapy Quality of Care Act, mandates an independent study comparing the quality of mental health and addiction care provided by the Department of Veterans Affairs against private sector non-department providers.
This study would evaluate treatment modalities like telehealth and residential care, looking at outcomes such as suicide risk reduction, wait times, and patient satisfaction. To keep an eye on all of these moving parts, Senate Bill 787, or the Vet PAC Act of 2025, would establish a 17-member independent body called the Veterans Health Administration Policy Advisory Commission. Appointed by the Comptroller General, this commission of experts would conduct annual reviews of Veterans Health Administration operations, including wait times, workforce management, facility construction, and budgets, and report directly to Congress.
That is a lot of oversight. Now, let us shift to how the department communicates with veterans. Senate Bill 831, the Representative VA Act, mandates that by January 1, 2026, all official calls from the Department of Veterans Affairs or its contractors must come from a consistent, recognizable number with clear caller identification branding. It also requires dedicated call centers for healthcare appointments and referrals in every United States time zone.
That would certainly help veterans avoid missing important calls, thinking they are spam. Another critical area being addressed is financial security and accountability. Senate Bill 892, the Veteran Fraud Reimbursement Act of 2025, is a bipartisan bill to protect veterans whose benefits are misused by appointed fiduciaries. It mandates that the Secretary of Veterans Affairs reissue the misused funds to the beneficiary or their successor and make a good faith effort to recoup those funds from the offending fiduciary. It also blocks negligent fiduciaries from receiving payments if the beneficiary passes away.
Accountability is also the theme of Senate Bill 124, the Restore VA Accountability Act of 2025. This bill streamlines disciplinary procedures for supervisors, managers, and employees within the Department of Veterans Affairs. It gives the Secretary greater authority to remove, demote, or suspend personnel based on substantial evidence, bypassing traditional performance improvement plans, and limiting the Merit Systems Protection Board's role in reviewing specific penalties. It also sets strict timelines and ensures these procedures supersede inconsistent collective bargaining agreements, while keeping whistleblower protections intact.
On the benefits side, we have Senate Bill 410, the Love Lives On Act of 2025. This bipartisan bill eliminates restrictions that terminate dependency and indemnity compensation and survivor benefit plan annuities when a surviving military spouse remarries. It also broadens TRICARE eligibility for widows and widowers whose subsequent marriages ended due to death, divorce, or annulment.
Along the same lines, Senate Bill 611, the Caring for Survivors Act of 2025, proposes increasing monthly dependency and indemnity compensation to 55% of the rate paid to totally disabled veterans. It also reduces the required period of continuous total disability rating for survivors to qualify from 10 years down to 5 years, with proportional payments for shorter periods.
For student veterans, Senate Bill 610, the Ensuring Vet Success On-Campus Act of 2025, expands the Vet Success On-Campus program to ensure at least one dedicated counselor is available in every state, prioritizing schools with the highest populations of veteran students.
And finally, on the veterans front, Senate Bill 478, the Veterans Second Amendment Protection Act of 2025, prohibits the Secretary of Veterans Affairs from reporting veterans to the National Instant Criminal Background Check System solely because they require a fiduciary to manage their financial benefits, unless a judicial authority formally determines they pose a danger to themselves or others.
Now, let us turn our attention to the House of Representatives, where artificial intelligence is a major focus. House Resolution 5351, the NSF-AI Education Act of 2025, expands the National Science Foundation's authority to support AI-related training and research. It authorizes scholarships and fellowships for students, teachers, and industry experts to integrate AI into classrooms. It also establishes up to 8 regional centers of AI excellence at community colleges and career technical schools, with competitive grants for K-12 AI teaching models, focusing on rural and underserved institutions.
To address the risks of generative AI, House Resolution 8893, the Protecting Consumers from Deceptive AI Act, directs the National Institute of Standards and Technology to establish specialized task forces. These task forces will develop technical standards for identifying and labeling AI-created content, using frameworks like watermarking, digital fingerprinting, and cryptographically verifiable content provenance metadata.
This would involve a coalition of federal agencies, tech developers, privacy experts, and media organizations. They will submit recommendations to the National Institute of Standards and Technology and provide annual progress reports to congressional committees for 5 years.
Lastly, looking at the House proceedings from July 6, 2026, the House met for a brief, primarily procedural session. They approved the previous day's proceedings and adjourned until July 9th. However, a wide array of new legislation was introduced, covering topics like federal employment barriers, environmental regulations for PFAS and consumer products, space security, and historical monuments.
The House also received executive communications, including reports on military actions under the War Powers Resolution, arms export notifications, and financial reports from federal home loan banks. There was also committee activity noted regarding lifetime injunctions for certain victims and a proposed constitutional amendment concerning the size of the Supreme Court.
As we wrap up today's episode, what should our listeners watch out for? Keep an eye on the House when they reconvene on July 9th, 2026, to see how these newly introduced bills progress. Also, watch the Senate Committee on Veterans Affairs as they deliberate on this massive wave of healthcare benefits and accountability bills.
Thank you for tuning in to Capital Catch-Up. We will see you next time.